So with that, we move ahead. And do we have Dr. Tanmay with us? No. So with that, Dr. Lopa Mudra. So she's going to present her poster on comparison of subtenons versus topical anesthesia. Nice, sir.
Good morning, everyone. My topic is on comparison of subtenon versus topical anesthesia in trabeculectomy and phacotrabeculectomy surgery. The newer anesthetic technique uses topical and subtenon, which avoid subneedle placement into the orbit with obvious advantages over the traditional blocks. However, the prerequisites of these techniques are a well-informed, motivated, cooperative patient and a skilled, competent surgeon. The aim of our study is to compare the patient pain and anxiety level in trabeculectomy and phacotrabeculectomy surgery under topical versus subtenon anesthesia. The objective is to compare the patient comfort, intraocular pressure control, and also the anxiety between the two groups. It is a prospective cohort study conducted at Arabind Eye Hospital with 90 patients in each group. In the subtenon group, 0.5% proparacan was applied, followed by a mixture of 2 ml lignocaine 2% with 1 ml 0.5% bupivacaine was injected in the inferonasal quadrant 6 to 7 millimeter away from the limbus. In the topical group, 0.5% proparacan was applied every 5 minutes, 4 times 20 minutes prior to the procedure, and 1% intracameral lignocaine was given during the surgery. The intraoperative pain and postoperative pain and anxiety level was assessed by using visual analog scale. The demographic profile of the study population shows the majority of the female has undergone surgery under subtenon and maximum number of male under topical. And the maximum number of trabeculectomy was performed under topical and maximum number of triple procedure under subtenon anesthesia. The baseline intraocular pressure in the subtenon group was 18.22 and in the topical group was 21.28, and there is no difference at the 3 months post-op. The comparison of the anxiety level prior and post block between subtenon and topical shows no significant difference. Similarly, the comparison of pain during surgery and 1 hour after surgery also shows no significant difference. While comparison of the anxiety level prior and post block in each group shows no significant difference, while comparison of the pain level during surgery and 1 hour surgery shows a significant increase in pain at 1 hour after surgery in each group. So the preferred practice pattern based on the long-term experience of the surgeon. In our study, 30% patients complained of pain during surgery and 83.3% 1 hour after surgery. And the overall pain tended to be mild in both the groups. The common complications in the subtenon were chemosis and subconjunctival hemorrhage. About 6.1% patient had anxiety prior to block and 11% had post-block. So to conclude, the comparison of the anxiety and pain level prior and post-block during surgery and 1 hour surgery respectively shows no significant difference between subtenon and topical, while comparison of the anxiety and pain level in each group shows no significant difference in anxiety prior and post-block, but there is a significant level of pain difference between immediate and 1 hour post-op. The IOP control at 3 months shows no significant difference. So the topical anesthesia can be considered as a better alternative in trabeculectomy surgery. But the surgeons would be encouraged to discuss the pros and cons of subtenon versus topical with regard to individual tolerance of pain, allergy to anesthetic, and needs for postoperative painkillers. Thank you.
Hello. Dr. Lupa, I'd like to ask you one thing. Your main concern is the pain and the discomfort of the patients. So why such a long follow-up of your patients in the study?
No, sir. We have considered the IOP control between two groups. That's why we have taken...
How will the subtenons or the topic anesthesia affect the outcome of the trabeculectomy?
Sir, that was just we took the IOP control. How was there any difference in the IOP control?
I'm just asking you, how will it affect any renal anesthesia, topical or subtenon? So how will it affect the outcome of any surgical procedure? For example, trabeculectomy in your case.
Suppose on the topical, sir, we thought sometimes we cannot complete perform all the steps. Suppose the iridectomy will be complete and the
If you think you can't complete, then why should you be even attempting to undertake that surgery? Ultimately, the surgical outcome is more important than the simple discomfort in case, and that's what you think. The outcome is ultimately what matters in this case. You are doing trabeculectomy so that the IP can be reduced. And in case you think your some regional anesthesia, whatever it is not able to take control of certain steps, I don't think so you should even attempt it.
I would like to ask a question. So this is a non-randomized study. So why couldn't you have done a randomized? So is there any reason?
We have selected patients and
Okay, for subtenons, again, there's a role for topical anesthesia, no? So you put the
we gave 0.5 topical, 0.5% followed by injection subtenon.
Yeah, so comparing both the groups doesn't hold water. So in subtenons also you use
Before
topical.
giving the subtenon, we to decrease the pain, we put 0.1, that is 1 drop of only. But in topical group, we have given 4 times, 20 minutes prior to the surgery, plus intracameral injection of 1% lignocaine.
What kind of glaucoma did you choose? Any particular choice for the type of glaucoma that underwent the surgery?
So, ma'am, we have taken all primary glaucomas and resurgeries, painful like neovascular glaucoma, all those we have excluded. And only the painful procedure resurgeries that we have avoided. Otherwise, we have taken the others. Primary open angle, primary angle closure, PXF glaucoma we have.
So the neovascular was excluded from the study?
Neovascular glaucoma, uveit glaucoma, all painful glaucoma we have excluded in our study.
Okay.
Even with proper block, there is a lot of patient experience hypotony at the table itself. Okay, and with the movement that may increase much more.
Sir,
So that is the point for topical.
So surgeon's point of view, there was inadvertent eye movements, and there was while holding the conjunctiva, all those was the touch sensation was more in the topical group, and looking to the microscope light was also a bit problem in the topical group, but that could be managed by the surgeon.
Even patient moves randomly, even if doesn't experience pain.
That is
we have experienced that in even cataract surgery also.
That was in the topical.
So that creates problem.
That is bit more in the topical group.
And how comfortable was the suturing when you come to the nylon or the vicryl? How comfortable was that with the topical?
If normally it was 15 to 20 minutes for trabeculectomy and phacotrabeculectomy surgery. So when there will be a bit pain in the end of the surgery while iridectomy or putting the sutures, what we put extra drop of topical anesthesia.
Okay.
If patient complains of severe pain, we give subtenon and we convert that patient to the subtenon group.
Okay.